Speaking. Hello everyone. Hi. Time flies. It's really fast. 3 months. Almost my last week here. But no, I won't. So the name is my journey in AMC. My full name is Xuwei Zhu, but it's really hard to pronounce by you. So I have got English name here. It's Dr. Zhu. Yes, it's much easier. So yes, I am an orthopedic. And I have finished about 130 flap cases and many replantation and many emergency cases. And I am 5 years attending, and I work in a big hospital in Zhejiang. And I have finished about 2 RCT and 2 basic science protocol which focus on the flap necrosis. And I have published several articles, and the latest one is the subdermal approach for harvest the PSP flap. And I think after researching the PubMed, this is the first publication of PSP in China, and this is the first case of PSP we have done in China, and it is the first case of the subdermal approach, of course. And this is the article I have published last years, and this flap I have done in 2023, and this is my favorite paper of PSP, and this case like this. So I will show some video about the subdermal approach. It's almost same at the beginning, like the SCIP flap. It's about after cut it, we will move into the subdermal approach like this. After finding the particle, the PSP here, we will keep going. Yes, and it's like this. Then the flap finished. Show some case of the flap. It's almost about 2 millimeter to 4 millimeter thickness. And I also try to make some biplan flap, like I will open the SCIP flap like this. It's about skin and fat. Actually, I want to add some vessel, like a lymph vessel and muscle and bone in it to make a Chinese chimeric flap. You know, this is killing. It's a son of the dragon. So it's like the deer, the foot is another animal, the tiger is another animal. So I want to create a Chinese kind chimeric flap. But I cannot find any patient suitable for this flap. So it's just an research, I think. So you always ask me where I come from, where is my city? This is my city. Actually, it's about 1.5 hour flight from Seoul. We have a direct flight. It's very easy for me to come to Seoul, and also very easy for you to come to visit my city. And I always told you it's near Shanghai, but it's near about 3 hours KTX. but because Shanghai is very famous, so it's in the middle of Shanghai and Taiwan. So I will show some video of my official, the video of the official government. Yes, it's Mandarin.
这是一座从山海经中走来的城市，这里是温润之州。
We have many mountains and rivers. We have many raining days, like we rain every day in April. This is the most famous mountain in my city. and most famous river, most famous island.
文脉流淌在这山水斗城桥楼间，在非遗工匠的巧手中流转，在戏曲故里的悠长中激荡，在永嘉学派的哲思中熠熠生辉。这里是活力之州，燕山瓯水拥抱着活色生香的人间烟火，
It's the most famous street.
敢为人先的奋斗，民营经济的发祥，改革先锋的探路，时尚风潮的绽放，是站在时代浪尖的搏击，缔造创业、创新、创富的传奇。这里是梦想之州，一脉朝运，风起朔门。
It's a very old commercial port. We found it about 5 years ago. It's about 1,000 years history.
是商行五洲，通达世界的胸襟，激荡海纳百川，枚枚与共的回响。大浪淘沙中，起锚的笛声是家国天下的情怀，潮起东方是四海归航的凯歌。千年商港，幸福温州。
Okay, we are very famous about business, and the first private company of China is here. So in the early of 1970s, all of Chinese company is public, but we try to build some private commercial. So you can see the map is surrounded by the mountain, and this is the ocean. And if we go to the morning to the mountain, we can see some nice view here like this. And I feel to being there with my colleague because I'm here. So this is taken by my colleague.
Really?
Yes. And if we go to the ocean, we can see some ocean view. This is taken by myself, and like this. And if you go to the mountain, we can see very many traditional classical Chinese building like this. And this is my daughter. So China is very big. So I used to travel a lot in my country, and I will show some place I most like. My favorite place is in the west and north of China. So this is where we turn to the near Kyrgyzstan. Yeah, this big area is a province named Xinjiang, and this is Tianshan Mountain. Actually, the mountain is go straight to the Kyrgyzstan, and if we go to this much south area of Xinjiang, this is capital of the south area is Kash, and we move to this mountain here, and we will find a very big mountain, very high. It's almost 7,000. It's named the Mustak, and if you go there, you sit in the lake under the mountain, and you can get this view. Then you can have a nice picnic with your family. This is me and my wife and my daughter. So if we move to another place to the north of Xinjiang, we can go to the Alatai mountain. We can go up. That is Alatai mountain, and it is also very famous. And in the mountain, there is a very nice lake named Kanas Lake. Yeah, this is Kanas Lake. It's very beautiful. If you climb at the top of the mountain, you can see the whole lake. It's like a diamond when its sunshine comes. So when you go straight to the Kanas River here in the morning, and you will get this view. Yes, it's also very nice. And if we drive to the middle of the Xinjiang, there is also another very nice. Here is the middle of Xinjiang. There is another lake, also very, very famous in China. It's named Selam Lake. They call it the last tier of the Atlantic. So if we go to this area, we can see some tent here. So if you just live in this tent hotel, in the morning you can see this. And when you turn back to the lake, you can see the sun rise like this. And in the night, in the midnight, we can see this area, and also many other. It is not in. It's in the middle of China. Yes, we can see this. So it's hard for me to give all of the view in China for you. It's too big. So I think I have do my best effort to make some contribution to Chinese travel economy. So welcome to China. This is Chaka Lake. It's salt lake. So let me introduce my hospital very shortly. We have 5 campuses with 5 divided hospital, and in the city like this. And my hospital is all about orthopedic. It's in this island. So because the traffic is very easy in the island, so they put the orthopedic department here. It has 3 buildings for ward and 1 building for outpatient and surgery. So this is the date for the like surgery or the patient. And this is all of the surgeon in my department, and it's named Hand and Micro and Bone and Wound Recon department. We have about 150 beds. It's almost 40 surgeons. Yes, I'm here. Yes, obviously I'm the most handsome guy here. Yeah. So during my career, I will try to replant every part of body if I can. So like fingertips or almost how deep it is, I will try to replant like this. This one, it's also success. And some hand replant, foot replant, scalp replant, ear replant. We also replant penis, but I did. It's very early. I'm not there. So I will do some composed flap and some composed flap for scalpel and some chimeric flap, and also toe to hand surgery. It's toe to hand, and I also do some lymphedema surgery. Yes, it's lymphedema surgery and VLNT surgery. So I have done the first case of LVA in my city and first case of VLNT in my city. Before that, we do not treat lymphedema. So why I come to AMC? The first day I come here, Park asked me, and I remember first day I joined Professor Peter's surgery. You also asked me why I come here. It's about 2021. I see GP's video in the YouTube. And at that time we do not do any SCIP flap. And when I see the video and finally I read your article, your article and Peter's article, GP's article, then I learned from your article to do how to do the SCIP flap. And after I learned the Park's article, I learned how to do the LMVA. But I have tried sometimes, but I failed to find the lymph node with a very small incision. So my teacher is here, so I come here. And I also want to come here to see why you can create so many new techniques. You can publish so many wonderful papers. It really helped me a lot. So when the first day I come to this bridge. Oh, I finally come here. I see the building I saw many times in the video. So the first day I do surgery with GP. Yes, I really nervous, but I didn't shake my hand. So when I visit his office, which I have so many times in his Instagram, finally I come to the office. I visit the office, and this is a Chinese style gift, and it names you are the master of the microsurgery. Yes, finally he asked me, "What's your dream?" So I told him my dream is in your office. So I just hold this medal, the Gardiner Fellow medal. Oh, I still remember when Park talked with me. I told him after drinking, I want to be the master of the micro, master of SCIP, master of PSP. So Park said, no. To be a master is too tired. You just be yourself, it's okay. So yes, if I want to win this Gardiner Fellow, it's very hard for me, very hard. So yes, I should choose a much convenient way to win this. Like this. No, not me. But it's not very formal. We should change to another place like this. Much better. Much better. I have got this. So I can enjoy my life now. So first I need to thank Peter. Thank for your research, and thank for letting me attend the first seminar. Yeah, seminar, right? Seminar surgery here. I really enjoy it. I really like your sunglasses. It's very cool. And also Kwan, and I know he is in Poland for a lymphedema meeting. And Kim, really proud of you. I know the first day you asked me to help you about the anatomy, I know you will win the first. You will win the first. And must come. Learn with him. He is the ultrasound master. Oh, really happy with you. I love you guys. And I wish you have a very safe military duty. And after that, come China with me. You know, Chinese girl like Korean oppa. And also Resident Park and the Nurse Khan, we really do a lot of surgery. And also, oh, they have left Uni and Chuzhou. Yes.
We have coffee in the midnight.
I still remember we have
We
coffee in the midnight
again.
after we finish Team A's party.
Because we are Korean. Yes.
This is Korean, sir.
Yeah.
Unfortunately, after the coffee, I get to sleep at 3 a.m. And lastly, I need to give my biggest thanks for Park. He's not here, I know, and we have drink last day. And I don't know the rule of the baseball, but I know number 4 is always best. So, and also he gave me the book of Lymphedema, and he teach me the VLNA and LVA, LMVA hand by hand. Really thanks him. We really have finished a lot of surgery together. And I really like the spring meeting in Guangzhou, a nice trip in Guangzhou with you guys. It's very nice, very happy there. So 3 months I have sit here, see friends come, friends go, many friends come, many friends go. And I like the Team A, I like like you guys intimate my like the feeling here, the surgery type, the work type here. And I also want to thank all of the professors from Team A and professors from some medical plastics department. And so Seoul is very a nice city. And I really enjoy the life here. And I like sunset, sunrise here. So finally my name is in the blackboard. And I hope maybe 10 years later I become much more famous. I have opportunity to put my name in another board. So at last, I want to use my favorite player's words, Kobe Bryant. This time, Dr. Zhu out. Thank you.
So, so after 3 months, what did you learn? Did you learn something or?
I learned a lot. And then I told you I have Microsurgery when I come here because about some privacy failure. I want to know how to anastomosis end by side to a very terrible side match, like a very small artery to a very big artery with a very thick adventure. So at that time, GP told me you need a wing graft to replace it or do some flow through. And I also have many questions about the anatomy of the SCIP, about artery, about the wing. But after I read Professor Peter's latest article about 2 new articles about ultrasound for the artery and cadaver and the clinical research about wing of the SCIP. So I get all of them. And I also want to learn how to do the side-to-end anastomosis of LVA. But I see Professor Kwon done it for me, and also JP and also Tip Park have done this for me. So the tip is to load the lymphocyte, then you can move both tissue out, then you can paint lymphocyte. But I think this is really very useful for me. And also the VLNT, you know, my VLNT had a skin paddle outside, and you cut off them and put it inside. It's much better and really nice. And I really learned a lot, and learn like the relationship between the professor and the resident. Really good, really nice. And the professor were very kind here, but the most important is not knowledge, not the knowledge. The most important thing is the friendship between me and the professor, between me and all the fellows here. I have got a lot of friends all around the world. So now if I travel to Turkey, I travel to Poland, I travel to Italy, travel to Thailand, I can find some friends to go out have a drink. It's very important for me. Thank you.
Thank you so much. Wish you the best.